A new weight loss program designed to curb food addiction is showing some promise.
And there's troubling information about the deadly Ebola virus. CBS 2's Lisa Sigell is here now with today's Health Watch. Lisa.
Hi, you guys. Yes, a new warning. A third American has contracted the Ebola virus while working for a missionary group in Liberia. Meanwhile, a dire warning about how fast Ebola is spreading. Another American doctor with the missionary group SIM USA in Liberia has contracted the Ebola virus. The charity's president says the doctor was an obstetrician who was not treating Ebola patients. The charity says the unidentified doctor isolated himself when he noticed symptoms and appears to be doing well. In August, SIM USA workers Dr. Kent Brantley and Nancy Reitbull returned to the USA from Liberia for treatment. Both have fully recovered. More than 1,500 people have died from the disease in West Africa. CDC Director Dr. Thomas Frieden just returned from a trip there and warns the epidemic is spreading faster than doctors can treat it.
And it's spiraling out of control. It's bad now. It's going to get worse in the very near future. There is still a window of opportunity to tamp it down, but that window is closing. We really have to act now.
Frieden is calling on governments, organizations, and private companies to pour money and other resources into West Africa, all to help doctors treat the rapidly growing number of patients. And Doctors Without Borders, the UN, and other groups are looking for experienced volunteers in the medical field to help treat Ebola victims overseas. Well, it seems a low-carb diet is better than a low-fat diet for weight loss. Researchers in Louisiana say a low-carb diet is also more effective at reducing the risk factors for cardiovascular disease, which at least a third of American adults have at least one form of. And finally on Health Watch, it may be possible to train your brain to like, even want healthy foods. It's true. In a small study, researchers at Tufts University divided participants into two groups. After 6 months, the brain scans of the weight loss group showed a change in the brain reward center that's associated with learning and addiction. Members in that group had an increased sensitivity to healthy, lower calorie foods and a decreased sensitivity to unhealthy, higher calorie foods. So what that means is we may be able to stop our cravings for junk food.
Oh, just not chocolate. Sorry.
Not chocolate.
Really?
We're never taking that away from you, Matt.
No burgers or hot dogs.
Yes.
Thank you.